6-year-old Wangari, a name that we shall call this girl from Naivasha in Nakuru County, is among people living with HIV in Kenya. Like many children below the age of 5 years considered to have advanced HIV disease, which experts define as CD4 cell count below 200, her diagnosis with HIV at only 4 years of age already predisposed her to a heightened risk of disease progression and, even worse, mortality. Her immune system had already been severely compromised at the time of her diagnosis, making it difficult for her tiny body to fight off opportunistic infections like tuberculosis, as explained by Mugure, a name that we have also given her guardian to protect her identity.
Alikuwa na wasiako, alikuwa na TB, sasa nikampeleka, akaangaliwa, akapimwa.
Still in the same sub-county, we meet Flora, also not her real name. She has lived with HIV since 2015. Despite global progress in early HIV testing and reducing HIV-related deaths, many patients like her continue to experience disease progression, an increasingly pressing public health concern that is compounded by defaulting on treatment, like was in her case.
2017 hali yangu ilidhoofika, nikarudi tena, nikapimwa, vipimo ikatoka tu ile tu. Nilikubali kunywa madawa zangu, nikakunywa mpaka 2019 tena, nikaona mimi nimerudisha afya yangu ya mwili. Nikazikataa tena. Lakini saa 2019 ikikuja kuisha nilidhoofika.
Advanced HIV disease mainly occurs when people living with HIV do not receive adequate and timely ART, according to experts. Some of the causes include late diagnosis, delayed treatment initiation, treatment interruptions, and pill burden, among others. People with advanced HIV disease are said to be at risk of death, even after starting ART. This risk increases with decreasing CD4 cell count. This predisposes them to diseases like tuberculosis, cryptococcal meningitis, and severe bacterial infections.
For people to have advanced HIV disease is the people who are not consistently following up on the medications. So you find most of the challenge we have at the male, and for age is approximately around 30 to 40 years.
As long as we have clients who are getting AHD, it means it's actually programmatic failure.
It is estimated that at least 50% of HIV-related deaths are associated with advanced HIV disease in Kenya. These mortalities are equally being witnessed at a time when the country strives to end AIDS in children by 2027 and HIV infections in the general population by 2030.
As we have achieved epidemic control, we still lag behind in the pediatric age group, where only, I think, 70% of children of the HIV status.
To reduce morbidity and mortality in people presenting with advanced HIV disease, experts recommend a combination of interventions. These interventions include screening, treatment and prophylaxis for major opportunistic infections, rapid antiretroviral therapy treatment initiation, and intensified adherence support interventions.
In the case of tuberculosis, we screen them first for tuberculosis, where we ask them few questions like if they have had any cough of any duration. For the same patient, we do a test called a CD4 count, where we check the immunity of the patient.
Kenya is also banking on other strategies to help prevent HIV-related deaths. Nakuru County, that reports an average of 70% HIV-related mortalities, is now leveraging on different strategies to help keep its patients alive. They include the availability of 4 advanced HIV disease hubs in Naivasha, Bahati, Nakuru PGH, and Molo that have brought HIV services closer to the populations and also ensured adherence to treatment.
We have a network of community health promoters that are actually distributed across all the sub-counties. We have 3,891 of them. And we also have peer navigators that are assisting us to do post-discharge follow-up.
However, advanced HIV care still faces challenges in the wake of the dwindling donor support. This includes frequent stockouts, especially for the management of cryptococcal meningitis, stockouts for diagnostics, and fragmentation of data. Kenya is home to over 1 million people living with HIV. Even so, the country still hopes to turn the tide in ending AIDS-related deaths through collaborations with organizations like Clinton Health Access to push for implementation of comprehensive package of care for all people living with HIV. Gloria Milimu, KTN.